John Martin and Tracy Plouk. Tracy runs Department of Mental Health. John Martin, Developmental Disabilities. Tracy came to me early and said, if we don't build a hospital in Cleveland and we put more money in the Northfield facility in Summit County, we can reduce our capital improvement needs, deliver better results to the patient. Well, from a political point of view, it's probably a pretty bad decision to not build that hospital because we got a lot of grief. But you know what? For the people who have mental illness, it was a great decision because they get more resources now. Tracy went up there to meet with the mayor. I think she thought I'd cave. Didn't you think I'd cave, Trace, when you got that? You didn't? Okay, well, come on up and talk about the reaction from the NAMI, and where is John Martin with Developmental Disabilities? John, come on up here a little bit. The reason, folks, this is so important is, look, you know what's happened in this state in the past. Chop these programs. You know why? They got no constituency. They only have a big constituent of one. And he's up here watching. You don't run over poor people. You just can't do it. Or the mentally ill or the disabled. You cannot do it. And John's come in, he's been a big reformer. I've told him, John, tell us what you need. Do not let us, and it's been fantastic. I feel, Tracy, go ahead.
Well, everyone in this room knows that resources were finite in this budget, and it was really necessary to make the best decisions in order to serve folks in the least restrictive and best clinically appropriate environments. And if we had not made the decision with the hospital in Cleveland that we did, we would have had to take the resources from somewhere else in our budget, which would have been community mental health services. And I thought that that was an untenable decision to make. So we've moved forward. The hospital was closed at the end of June, and folks have been relocated successfully to Northfield, which is in northern Summit County. But with that said, our core focus this year and going forward is community mental health services and what we can do to protect and augment how we're delivering mental health services through partnerships and thinking as strategically as possible about the resources that we have, regardless of what that resource level is. And I've been working in great partnerships with the boards and with the providers to say any additional investment that comes to us in any way, shape, or form, whether it be public-private partnership or additional state resources or folks locally saying, hey, I've got a little bit more over here. The more that we can do together to create an economy of scale that might transcend some specific communities and actually reach a broader area is really the way to go, because that's the more strategic way to use the resources. Housing is something that's really important to me, but if you have a specific housing need in one community and you've only got a couple of folks to serve, if you partner with someone who is in an adjacent area, you can actually stretch those resources further. So that's the kind of cooperation that we're attempting to engender, and I think that people are generally very excited about this and see great opportunity. So I appreciate the support that we had during the budget from the governor and from both houses of the General Assembly, and I really think that we need to continue to work in partnership to be as impactful as possible.
Let me hit the nail on the head on what she's saying, because it doesn't really say it exactly. If you're working in a county and you got a nice job and you can work with somebody in another county and maybe your title is changed, but you're going to save a lot of money, please do it. Do not put turf or silos in the front of who we're trying to deliver these services to. NAMI was out here last week, National Association for the Mentally Ill, and I told them that, you know, we're going to do the best we can. There'll never be enough money for all this. But you know, John Martin has driven this inside of developmental disabilities. You want to talk, you get a guy. You want to get something done, you get a woman. And it's the women inside of developmental disabilities that have driven this change, and he can illustrate exactly what it is that Tracy is pushing for here.
Well, thank you, Governor. As I think a lot of you know, our system serves some of Ohio's most vulnerable citizens, and some of whom need a lifetime of support, and others who just need a little push, a little help to help them get a job and be more independent. And one of the things that we've been doing, and that Tracy alluded to, is working with our local county boards so that in this very tight economic environment, we are reducing administrative costs and overhead so that services to our most vulnerable citizens are not jeopardized. And so we have some really neat examples where a couple county boards have shared a superintendent, and from The money saved from doing that, they've been able to serve 5 individuals on waivers that were not served before. And we're starting to see that replicated across the state, as well as working with stakeholders to get folks out of more expensive segregated settings into less cost-effective and more integrated into the community sorts of settings, which is what people want. And in addition, we've got some new technologies in our waiver, and a new waiver, again, to help with more cost-effective services in this difficult economic environment. So we too appreciate your support, Governor, of all of our field. And again, as you know, the work gets done by somebody other than me.
You know, John has a son who's severely developmentally disabled, and I first met John, he told the story of trying to help his child to chew. Want to complain? Think about his son and how he bit John's finger. And John had to come to realize the way in which he worked with his son when he ate. This is what we're talking about, folks. This is what we're trying to get more resources to, so that mothers and fathers and these people who are in a tough position can be helped. And look, there's never going to be enough money. So it's just the way it is. It's life on earth. But we're going to do the best we can and get through, you know, and build a better system. For Tracy, we need better community mental health. We released them all. Jim, you remember in the legislature, shut down all the institutions. At the end of the day, there were nowhere for them to go, so you see them standing on the street corner with a big trash bag filled with their clothes because they're living on the streets. And this is something we've got to do, and get more jobs in here, have more revenue. We can do better. Thank you both for being here. Okay, job wins. American Greetings, Bob Evans, Diebold, Omnicare, Chrysler, Republic Steel, Ford.